How can a CT scan decrease your chance of having a heart attack? Stay tuned. Hey there, Dr. Perry here from Lightbox, where we shed light on all things radiology to empower you on your journey to better health. For those of you that are new here, I'm Dr. Perry Canaria, board-certified neuroradiologist and patient advocate. There's a link to my bio, and I'm here to simplify the world of medical imaging in a way that everyone can understand. Be sure to like and subscribe and to hit that notification bell so you'll be notified as soon as we drop new content. Today we're going to talk about coronary CT angiograms. What are they, and should you ask your doctor if you need one? To find out, we're going to hear from a viewer named Paul in Boston who writes, I'm 56 years old and my doctor wants me to get a coronary CT angiogram because I sometimes experience chest pain and shortness of breath while exercising. The doctor mentioned that the test may involve AI. What exactly is a coronary CT angiogram? What will the results tell my doctor, and how would AI help? So without knowing any additional information, it sounds like Paul's doctor wants to know whether or not his symptoms are due to coronary artery disease. But what exactly is that? Let's start with a quick anatomy lesson. The coronary arteries are the blood vessels that supply blood and oxygen to the heart. Over time, these arteries can become narrowed or blocked due to plaque accumulation, which is basically an abnormal buildup of fat, cholesterol, and calcium along the inner walls of the arteries. Now, when plaque builds up inside the coronary arteries, blood flow to the heart decreases, causing symptoms like chest pain, shortness of breath, and potentially even a life-threatening heart attack. So one of the main goals of radiology in evaluating patients with chest pain is to get a detailed look at those coronary arteries to see if the buildup of plaque is the cause of their symptoms. And that information helps doctors determine the best treatment plan, which may include lifestyle changes, medications, or a therapeutic procedure like balloon angioplasty with stent placement to help open up those narrowed vessels. Now, before CT scanners became so advanced, the primary way for doctors to look for plaque in the coronary arteries was by performing a coronary angiogram, also referred to as a cardiac catheterization. But what exactly is a coronary angiogram? It's basically a specialized type of test where the doctor inserts a long, thin catheter in the wrist or groin and then slowly pushes that catheter into the chest, where they inject X-ray dye, also known as IV contrast, into the beating heart to get real-time X-ray images of the coronary arteries that look like this. Now, coronary angiography is a relatively safe procedure that can accurately detect coronary artery narrowing due to plaque formation, and it can also give doctors the opportunity to place a stent to open up those narrowed vessels right there during the procedure if necessary. But how do doctors know whether or not a stent is necessary? Before they make that decision, they measure something called FFR, which stands for fractional flow reserve. Now, FFR sounds complicated and the math is pretty fancy, but I'll simplify that for you in our next video when we talk about how AI technology can safely calculate FFR without needing to stick a catheter in your heart. Now, even though it's an extremely useful test, coronary angiography has a few expected drawbacks that you should be aware of. As with any procedure involving blood vessels, there's always a small risk of bleeding, infection, damage to the blood vessels, or potentially an allergic reaction to the IV contrast. Other drawbacks of coronary angiography include more preparation time, longer procedure time, and a longer recovery period, which is usually a few hours. Now, despite these expected drawbacks, doctors may still recommend a coronary angiogram depending on your exact medical history and risk factors. But for certain individuals, there are other effective and non-invasive ways to evaluate the coronary arteries. For many people, a coronary CT angiogram, also known as a coronary CTA or CCTA, can be a quick, reliable, and non-invasive alternative to traditional coronary angiograms. But what exactly is a coronary CTA? It's basically a specialized type of CT scan that creates high-resolution 2D and 3D pictures of your heart and coronary arteries, and it provides a lot of the same information as a traditional coronary angiogram, but in less time and without all those added risks of an invasive procedure. In many ways, this type of CT scan has become a real game changer in the way doctors evaluate patients with chest pain, because it can quickly, accurately, and safely determine whether or not coronary artery disease is a cause of your symptoms, and that information helps your doctors determine the best treatment plan for you. So how exactly is a coronary CTA performed? Once you get a request from your doctor, you'll schedule the test at a medical imaging center. During the appointment, you'll fill out some standard paperwork about your medical history. Be sure to mention any allergies or kidney disease you may have, because the IV contrast you'll receive during the coronary CTA could potentially cause an allergic reaction or damage to unhealthy kidneys. Before the scan, you'll be hooked up to a special type of EKG to monitor your heart rate, and a small IV line will be placed in your arm. After that, you'll lay down on the CT scanner, and just before the scan starts, a small amount of contrast will be injected through that IV, and as that liquid contrast flows from your arm into your heart, the scanner will start taking special X-ray images that provide very detailed pictures of your heart and coronary arteries that look like this. Now, the doctor that reads your scan will most likely be a radiologist or cardiologist, and they'll be looking very carefully at the images to see if there are any narrowed coronary arteries like this, where plaque is slowing down blood flow in your heart. And that slow blood flow may explain your symptoms. Now remember, your heart is beating throughout the entire scan, and for that reason, the X-ray images are timed in a way that matches your heartbeat. So, if your heart is beating way too fast like this, you may be given an oral medication called a beta blocker to safely lower your heart rate so it's more like this. And that slower heart rate will allow for a much better scan. They may also give you an oral medication called nitroglycerin to safely dilate your coronary arteries and make them more visible. The entire scan can last up to 30 minutes, including prep time. Once the test is complete and you're feeling well, they'll remove the IV and the heart monitor, and you're free to go home. Now, the main risk of coronary CTA is an allergic reaction to the IV contrast, but if you do have an allergic reaction, it's usually mild in the form of a skin rash, itching, or sneezing. So if you have an existing contrast allergy, it's extremely important to mention that when you schedule your test, because you may need pre-medication prior to the scan to minimize the risk of an allergic reaction. So, should you ask your doctor if you need a coronary CT angiogram? If you're experiencing symptoms like chest pain or shortness of breath, or if you have a family history of heart disease, it's definitely worth seeing your doctor and having that conversation. They'll determine if a coronary CTA is appropriate for you. If your doctor has already provided you with a request for a coronary CTA, please click the link below to schedule that test. And be sure to watch part 2 of this video, where we talk about how new cutting-edge AI technology has the potential to improve your care and maybe even save your life by giving doctors even more valuable information about your coronary CTA. As always, thanks for watching. Keep asking great questions, stay healthy, and we'll see you next time.